Hi everybody, it's Cookie Lou in Arizona, and I am finally back from Monterrey, Mexico. I had my surgery with Dr. Sauceda on November 29th, and I arrived in Monterrey on the 28th, had the surgery in the morning of the 29th. Was in the hospital for a few days and got back into the Hampton Inn Hotel on December 1st, and I spent a good 14 days there recuperating, and I left the morning of the 15th to return home to Phoenix. And I'm glad I took the extra time. I think Dr. Sauceda allows about 10 or 12 days of recuperation with the package for these surgeries, and I stayed about 5 extra days because I wanted to make sure that my my drain was out, my stitches were out, my incision was at least 50% healed, and that I was in good shape to travel home back to Phoenix on my own. It was a good experience. I did have a little bit of an issue in the hospital this time that I did not experience the first time. First time the nurses spoke English, or they had telephones where they spoke in Spanish and it translated in English. Communication was much better. I didn't have it this time. They were very prompt when you rang the bell. They came right away. I didn't have that this time. Uh, and briefly, what had happened was that I had my IV in my hand. I don't know what the situation was, but I was in bed. It was the day after surgery, it must have been the day after surgery, and they had taken the catheter out. And I was in bed, and of course you're loaded on drugs, and the IV pole was on the left side of the bed, and the bathroom was on the right side of the bed, and I had to go to the bathroom, and I had to go, and I just turned to get out of the bed, not realizing I was tethered to this IV pole on my left. And when I went to get out of the bed, my arm pulled and that IV pole came down, bam, hit me on the head, went all over the bed. I'm peeing all over the place now, and I'm stuck because I can't get, so I had to go around the bed, get the IV pole, and I'm screaming, nurse, nurse, and I'm hitting the button, help, emergency, help. And nothing. So I got up and tried to got around the bed, got the IV pole up, and I walked into the hallway and nobody. And then I go through the doors where the nursing station are, and nothing, nobody. And I'm screaming, nurse, nurse, where the hell is everybody? And this guy comes over and says, you need a nurse? I went, yes, I need a nurse. So anyway, finally, somebody came out. I don't know where the hell they all were, and I was complaining, what the heck is going on? I said, Maria, and then when I got out of the bed, I was trying to get to the bathroom to get toilet paper or a towel or something to mop up. I was a leaky mess, and there was no toilet paper, and I couldn't find a towel. And anyway, here I am ranting and raving, and nicely getting my point across. And she's looking at me like, she probably didn't know what the hell I was talking about. But anyway, I got them to come back into the room and brought me toilet paper and a towel. And thank goodness Dr. Sauceda came in, and I told her, look, I don't mean to complain, but I have to tell you about this. He says, well, and as I'm telling him the story, he's texting me something. He says to me, the hospital doesn't work for me. I have no control here. I have nothing to say. But he says, I'm sending you an email with the list, with the person to contact who's the administrator of the hospital. It would be better if you directed your complaint directly to him than if it came from me. So I says, fine, but I just want to let you know that they might not work for you, but they're taking care of your patients. And if you have patients in here and there's a situation like this, you should be aware of it. He says, well, yeah, I'm glad you told me. Anyway, that was my negative moment. And he told me, well, you're ready to go home tomorrow? I went, absolutely ready to go to the hotel and continue to recover there, which is, so pampering, you know, when you're in the hotel. It's just sleeping and resting, and the beds are so comfortable at the Hampton. And Patty comes in every day and pampers you, and you know, helps with showers and washes your garment out, and then you know, I'm in the shower washing, you know, and she's cleaning my garment, and then when I'm ready to get out of the shower, she's there with the towel and she's drying you off and patting your incisions everywhere and checking the incisions, and then she dresses the incisions with ointment and bandaging, and encourages you that they're, you know, that everything looks beautiful. This is swollen. This is swollen. Don't worry, it's going to get better, and everything looks wonderful. You're healing. No infections. Very good. And this is every day, as long as you were there. And even though I was there, I extended my time at my own expense with the hotel, which was about $350 American more for 5 extra days, and well worth it. Well worth it to just to have that extra time with Patty taking care of me and Dr. Sauceda coming in, and so anyway, surgery went well. They put this garment on you, you know, with a bra, which is a faja. And I think this size here is an extra large, and I probably could have used a bigger size because they're tight. Now, what I did do is you know, I tend to have a little leaky thing every once in a while with bathroom things. I usually wear a pad or something, but I brought some diapers with me, which I found very helpful. These here were the Always Depend Boutique, Discreet Boutique, as you can see. Because when you're wearing the faja, you're completely opened in the back and on the bottom, which is, you know, where you need to be, the way you need to be when you have to alleviate yourself. But when you're wearing a little panty over that, you kind of feel like, you know, you're protected and you're clean and you're covered. And there is leaking blood from drains all the time. By the first day, with me anyway, there's always blood all over the place. So this comes in handy too as far as trying to keep things absorbed and clean. So I recommend that if you go and you're having anything done down there, bring a little diaper with you. That's my tip of the day. I'll get up and kind of give you a little view of what I look like. It's only been, 2 weeks? 2 weeks? It'll be 3 weeks, I think, on Thursday. So anyway, the doctor took 7 pounds off my stomach and hips total. I had asked him how much he took off. He says, I don't know, I didn't measure. I said, what do you mean you didn't measure? It's important to know. I mean, usually people get photographs. I didn't really need a photograph. I'd asked for one, and he didn't provide one. But I did want to know how much. And but of course, Patty knows everything. And Patty says, because she was in the operating room. She does that now. She's also participating in the actual visual assistance of the operating room. Because when I went in there, you know, to get all kind of hosed down with iodine and getting ready to hop on the table, as usual, you know, you walk into this little room and there's white sterile, blue sterile sheeting everywhere. And everybody's covered in blue sheets of garments of, you know, hats and masks. And I know, of course, Dr. Sauceda's wife, Gabrielle, I mean, she's always standing there ready to knock you out. And she goes, hello, good morning. I says, hello, Gabby, how are you? And I had seen her prior in the parking lot when Dr. Sauceda was bringing me in that morning. I had seen her. And she gave me a big hug. She says, are you ready today? I said, I'm ready today. Are you ready today? So then I saw her again, of course, in the operating room, and standing next to her was another little nurse. So happy, so, hello, Lucia, so nice to see you again. Hello, how are you? So good. Oh, what a pleasant nurse. She's so sweet. You know. And then I'm standing there, you know, as they're dousing you down with this sponging of iodine, and I'm going, and then I see in the eyes over the hat and the mask, Patty. I says, you're Patty. She says, yes, I'm Patty. And I just noticed the eyes, and I realized now that it's you. I says, what are you doing here? She says, I help Dr. Sauceda now with the assistant, the instrument or whatever. And it's always good because she takes so much care and she has so much knowledge of plastic surgery. That's all she does is work with plastic surgery patients in the hospital every day. So she's getting to see this portion of the surgery as well as the after portion of the surgery. And she's so excited about this new experience. So she got to tell me a whole lot of stuff, about how he operated on me. She's the one that told me that there was 7 pounds removed of skin and flesh, whatever. And she says at first, which I thought that they worked on my left hip first because I wanted the extended tummy tuck and I was very concerned about the fat on my hips. I wanted them gone. I wanted those little doorknobs gone. And they are. I'm very happy about that. So they told me when they got on the table to get all the way on my side. So I thought they were going to start cutting on that hip. But she told me, no, they didn't. They put you flat on your back after you went to sleep. And he did my tummy tuck. And then he did my breast. So all the body, the torso and breast was done first. Then they flipped me over and they did the left hip. They cut that out. And then they flipped me on the other side and they did my right hip and they cut that out. So what you see actually is just one long incision that extends beyond my hip, probably halfway. I would say maybe another 8 or 9 inches and it would have been a 360, belt tummy tuck type thing. But this is an extended tummy tuck that went 8 inches more on each side. So a regular tummy tuck from hip to hip is about 10 inches. Dr. Sauceda, when he extended me to get rid of the hip fat, went another 8 inches past that mark on each side. So it's a total of 26 inches worth of incision. And the augmentation part, he said he wasn't going to cut the nipple. He was going to just do because I had the lift and the implants removed 6 months ago. My old implants that ruptured and there was a big mess with that. They were taken out 6 months ago. So for 6 months I've been living with these really tiny deflated balloons and they did need to be refilled. So when I met with him for the markup the night before, we decided on the type of implant that he would use and I wanted to show you. And oh yeah, here it is. It's called Motiva. This is what he uses now, and it's a cohesive gel implant. It comes in 3 sizes like most of them do. It's the just a round flat one, which is I don't know, like a normal, and then they have one that's moderate as far as fullness, and they have one that is an extended moderate, an extended, I'm not thinking of the words anyway, high profile. There's high profile, and then there's moderate profile, and then there's low profile. So for what I needed, we decided on the moderate profile gel, kind of the gummy bear thing. And he did all that first, and then he did the hips, and I have that long incision. Hip to hip or beyond hip to hip, and it's healing really well. He said that he wasn't going to cut my nipples anymore when he put in the implant. He was going to do the stick portion of, a lollipop is like around the nipples, incision, and then down. And he was going to just go on the stick portion of the lollipop, open that up again, put the implants in. But he didn't. When I woke up, I noticed that the lower part of my breast was cut, and he went into the nipple and put the implants in that way, which is fine. Of course, I had a pocket there already from the first surgery 33 years ago, and he says that he used the same pocket, the same area, and he checked everything well because of the leakage that I had at 6 months ago. When he did take out the old implants and one was ruptured, he checked to make sure everything was still clean and that there was no inflammation or infection or anything abnormal. That's why he wanted me to wait the 6 months to make sure that I healed up really well. And he said everything was wonderful. And he said I popped in the new boobies. And that's it. I did real well. I'm glad to be home. I'm still wearing the faja. There is swelling, of course, in the tummy. The faja's tight as hell, and it's really hard getting it on. This is the time when you need a husband to kind of help you clip your faja on in the morning. But I manage. I manage to do it, and I take my shower every day and do the patty method of the gel, the antibiotic gel, and then she told me when I got back I didn't have to put any bandaging on it anymore. Just put the gel on to keep it from drying up because it gets itchy. And she says just a little bit of gel and then put on the faja. But I put my bandaging on. I'd rather have that covered. And of course I still do cover the belly button because everybody that I know that has had a tummy tuck has had to put some gauze in their belly button to keep it dry and what have you. So I put a little bit of antiseptic ointment and then a little bit of gauze and I tape it. And I'll probably do that for the rest of the week, and then I won't bother with the bandaging anymore. But I will probably continue with the belly button. I'm going to take a walk back there, kind of show you what I look like. Let me raise this here up. Let's see if that'll work. So everything is very flat, as you can see. I'll kind of lift this. It's cold today. They have some really heavy stuff. And this is pretty much, I'll get a little closer to what it looks like down here. This is why I do wear this is my boobs. They have 400 cc's, which is probably considered a D cup, and they are swollen, will go down. And this is I had brought about four or five little diapers with me, and I ran out of them because, like I said, I was there for almost 2 weeks, so I went to the HEB and I got some more diapers. So this is the Mexican Depends Grande diaper, and so this is pretty much is what the faja is like, and then this is the bra. So the faja ends here and the bra ends here. And there's straps, and clipping this thing together can be quite difficult. But I manage to get it done, and the more swelling goes, the more the swelling goes down, the more comfortable the faja is. And of course, if you keep your meals light, you don't eat heavy, and you can't eat heavy anyway with this thing on. Believe me, a couple of bites and you're done. And that's about it. So anyway, I just wanted to check in and say hi. I know this is a very long video, so if you're still listening, thank you very much. And if you have any questions, of course, let me know. I'll be happy to answer them. And I will make another. I do have some, photographs that I had taken, of me and with the drain and without the faja on. There's a few things here. This is the room that I was in, and I'm going to try to do. There's a little, picture of Monterrey, Mexico, and I'm going to try to make another video. This is the drain that they were using. It's something that was new. Because I didn't like using these drains because they usually clog up. It looks like this little accordion thing, and they usually have these little ball drains. And he said, we didn't have any in the operating room, and I had to use this one because it was the one that was on hand. And it was a pain in the ass. The reason it was a pain in the ass is that whenever you wore any clothes, it looked like you had a boner. You see that? No matter what, I didn't know what to do to hide the damn thing. It kept sticking up, and I kept putting it in the But anyway, so I was going to make some more videos with some of these photographs. And so that's about it. Okay, I'm going to say goodbye, and I hope everyone has a great week. Okay, bye from Cookie Lou. And thanks very much for your prayers and your good thoughts and your support. It really helps when you're going through processes like this to know that there are people out there that love and support you. So thanks, everyone. Hugs and kisses. Bye.